So, Mrs. Rogers, I've done your history, we've done your physical and your neurological exam, and I'm happy to say that everything looks really normal.
It doesn't feel normal, Doc. I mean, I've been dealing with this for the past week, and it's not getting better. I feel like something's going on.
What are you worried about?
I recently reconnected with a college roommate who told me she'd been diagnosed with a brain tumor.
I'm sorry to hear that.
And, leading up to that diagnosis, she'd been having headaches for like long periods of time.
Okay.
So I'm kind of worried that this could be something like that.
I understand. So you're really concerned. And I can understand, given the stress you have and that recent news, that must be really worrisome for you. But I can tell you that when I did your physical exam and your neurological exam, I took a look behind your eye. There was no, sign of any increased pressure that might be symptomatic of a brain tumor. When we looked at, your visual fields, and I tested your visual fields, and I kind of said, look here, look there. There was nothing abnormal about that. And that's all very reassuring that this isn't related to a tumor. And it's really most likely just stress or tension headache.
Well, do you think we should get a CAT scan just to be sure?
Well, a CAT scan really isn't indicated at this time because when your history and your physical exam is normal and when you're looking at tension headaches, we don't need to do a CAT scan at all. Actually, it can pose more harm with unnecessary irradiation.
Really?
Absolutely. And that's one less test that we have to order, one less thing you have to wait for and be concerned about. Would you feel more reassured if I give you some information on when CAT scans and MRIs are necessary?
Maybe, yeah.
Okay. Well, I took the liberty of printing out a handout for you that goes over when CAT scans are necessary for headaches while you were getting dressed. And basically, from studies that they've done with people with common headaches, there is no CAT scan necessary. And like we said, it could pose more of a risk. Okay. You can take that home and read it. Now, are there things that we can do to help you reduce your stress, to help your headaches?
I don't even know. When I was in school, I used to do yoga.
Okay.
That was a pretty good stress reliever, but I haven't done that in years.
Okay.
I guess I could try to find a class and do some yoga.
That sounds awesome. I think that'll really help. The other thing I can do on my part is to prescribe some anti-inflammatory medicine for you, like Motrin, because Tylenol didn't work so well for you before. How does that sound for you?
If you think that'll work better, yeah, I'd love to try that.
Okay. Then, is it okay? Are you okay with the treatment plan that we don't do a CAT scan at this time? We try some stress reduction exercises like yoga. And we treat your headaches with some Motrin, and then you can give me a call if anything changes.
Yeah, I think so.
Okay. All right. Do you have any questions?
Nothing else right now.
Okay. Well, I think we have a good plan. How about you?
Yeah, I think so.